On today's show, feedback from the front lines on the voluntary merger. We'll tour the new Ronald McDonald Family Room. Our French family health team officially opens, and we relay for life. Hi, I'm Dan McGann. Welcome to Contact. Now that the Credit Valley Hospital and Trillium Health Center have merged to become one organization, we spoke to two people providing key leadership during this time. Alan Torrie is the chair of the board of directors for the new merged hospital. He joined the Trillium board in 2008 and served as the vice chair and the chair of the quality committee before assuming his new role. Michelle DiEmanuele is our new president and chief executive officer. She has spent her career in the public and private sectors leading large-scale change and cultural transformation. Here now are their insights on what the merger means to staff, patients, and the entire community.
People of Mississauga will have seamless access to services across the network of the hospitals, and the information will follow the patient about that patient, and that will allow everybody to get to the problem quicker and get it solved faster.
So I think this merger presents an outstanding opportunity for our region. As you know, we've had a history of two great hospitals delivering outstanding care. But coming together provides us a huge opportunity for the future to be able to be a regional center delivering state-of-the-art healthcare close to home. We'll be able to pool our resources, our physical resources, our equipment resources, our people resources in a way to deliver care into the future that we could never have done as a single hospital. For example, we're looking at a robotics program. A robotics program could provide state-of-the-art surgical interventions in the areas of cancer that either hospital alone would not have been pursuing.
Quality is very good today, but it'll be more sustainable and even better in the future because of the ability to attract people to this expanded platform, the skills and expertise of physicians and other healthcare workers, and of course our affiliation with the University of Toronto Medical School.
Even in the early days as being the president of the new hospital, I've seen great opportunity to be able to share experiences so that we can all elevate our performance in delivering outstanding patient care in this community.
Well, both hospitals, before they decided to merge, were contemplating their vision of the future, and as it turned out, they both had the same vision. And that vision was to create one integrated, community-based health center with academic capability that gave a platform for being able to sustain healthcare for this community well into the future.
I think there are 3 or 4 things that we have to continue to hold at the center of what we do. One is a seamless patient experience. It shouldn't matter which door you come through, how you are treated in any of these sites, how your care is administered should be the same, at the same standard and quality and level that you would get at any of the sites. And I think that has to continue to be at the center of everything we do. Secondly, I think our community expects us to do this in an efficient, effective way with high integrity, and we will continue to use our resources in the most efficient way to deliver that highest patient experience. I think, thirdly, we have to constantly look to the future. And so it isn't just bringing 2 hospitals together and 1 + 1 = 2. It has to be 1 + 1 = 3. What growth? How can we be thinking about the future of healthcare in our local community so that we are constantly offering a high level of services that are relevant? And lastly, I think we have to think about our relationship with the University of Toronto and our new medical school. This provides an opportunity for us to grow the future generations of physicians who hopefully will stay here and practice locally in their community. So if I look out a year, in our new hospital. If I take it from a very simple perspective, I hope everybody starts to talk about this as one hospital and one patient experience. And we have a name, and that people understand the things that we're focused on, 2 or 3 critical things that are going to help us be better for the future. If a year out we're able to do those 2 or 3 things, I think we will have had great success.
It's really difficult in healthcare to predict what it's going to look like 5 years from now, because technology, services, and capabilities are changing in the field so rapidly. But there are a few things that for sure I know that people will experience 5 years from now that will be better than today. One is access, seamless access to an integrated system. Timeliness of getting to the bottom of issues because of the information and technology and the capability of the staff. And the programs and services that perhaps aren't as readily available close to home will be much closer to home and provided right in our backyard.
When I look out 5 years, I think about we've been able to deal with the unprecedented growth in the city of Mississauga, West Toronto, and our region of Halton, Mississauga, that we have been growing at 7, 8, 9, 10% in some of our programs, and that growth has been dealt with because we've constantly been asking ourselves how best to deliver care. And that gets measured by reductions in wait times, and in a reduction in people having to go outside of our region for care, that we really are delivering the best care in as many different areas closest to home. That, for me, 5 years from now would be a success factor. When I look internal to the organization, we will have attracted some of the best and brightest clinicians in our province and in our country. They'll want to come work here because this is a hospital that provides the best platform to deliver services with the best people to deliver it with. And so being able to attract world-class physicians, nurses, and researchers, those kinds of indicators would be there for us. We're already seeing some of those benefits occurring today because of the merger, and we'd see more and more of that.
I think that we are really embarking upon something unique here. Our vision is to become a premier community-based, patient-centric academic health center for Canada. And it's got all the implications of being a leader rather than a follower.
And so as I think about the future and as I think about the past, it's one that is both motivating, and it's one that is of high integrity, of high accomplishment, of great success. And I am truthfully humbled and excited to be able to work with 8,000 people who every single day are going to come through our doors to deliver outstanding care and services to our community.
Healthcare is changing rapidly, and if we lead that change and be in front of it through the capability we have with these merged institutions, then we'll be able to provide a more effective, more efficient, higher quality healthcare system for the community than it would have otherwise. So the journey is going to be about that. It's going to be getting to that destination, and once we get there, discovering what's next. And I think that journey will be a challenging one, but it's very worthwhile, and it's going to be a lot of fun for the people that are working in the institution, and it's going to be of great benefit to the community we serve.